Lance here, Fight HHT with me. Bit of a late one and an unusual one, if I'm being honest. So we just spent, like 2 hours at urgent care trying to get seen. Recently, we found that our daughter's eczema was getting a little bit rough around her hands, and it looked sort of bad and maybe even infected. For us, with our condition and what we suspect for her to have AVMs, we're still working on that referral, but any bacterial infection could be potentially problematic with AVMs in the lungs. So seeing that my daughter has this eczema on her hand, we were already kind of a little bit on high alert. But then we found a sore on her today, on her skin, and it doesn't look great at all. It just sent us into another level of concern and trying to make sure that she's properly cared for. They think that she either has some sort of infection on her skin. So she has a prescription coming our way, so we're going to take proper care for it. But having gone through what I have in the last 5 years, it's a little bit frustrating, and I know that I have to kind of step back and still present myself as a patient. It made for an awkward conversation with a doctor. He looked at me like, are you the doctor? And I was really just trying to ask informed questions and provide what I thought was informed feedback, because when I mentioned HHT, I mentioned hereditary hemorrhagic telangiectasia, I mentioned Osler-Weber-Rendu. Unfortunately, the medical professionals looked at me like, bless you, do you need a tissue? It sounds like you just sneezed. So long story short, I go in and say, hey, we have HHT. She probably has AVMs in her lungs. We're waiting to get a referral. And the doctor goes, is that an AVM? Is that a known AVM? Have you talked to so-and-so? And we're like, no. We just found this. We're trying to be preventative. We're trying to make sure that this is not become more problematic. Having a rare disease, when things happen, it leaves a lot of questions as far as who to turn to. And then when you're navigating these things for the first time, it's a lot of questions about what information to trust and how to go about things when you are the first people to have to go through these things and not know the proper care. But anyway, that's tonight. We feel a bit more comfortable now. Just the first times for these things are very stressful, and when you don't have proper care, it's tough. That was tough. We're all drained. We're home now. She hasn't even had dinner. She had a popsicle at the urgent care. It was just really nice of them, but big sigh. So anyway, have a good night. Bye.